Welcome to Care for PA's Monthly Minute. I'm Tim Oram, Director of Legislative Services for the Hospital and Health System Association of Pennsylvania. After a much publicized, month-long debate, Congress and the President reached an agreement on our nation's debt limit just one day before it reached its legal limit of $14.3 trillion. The agreement calls for two things: the debt limit to be raised and $917 billion in federal cuts to be implemented over the next 10 years. More than 7,000 emails were sent from Care for PA to lawmakers urging them to not cut Medicare and Medicaid funding for hospitals as part of that agreement, and because of you, cuts were not included. However, the agreement does leave the door wide open for what could be an even more severe cut later this year. A special congressional committee must find an additional $1.2 to $1.5 trillion in federal cuts before November the 23rd. If their proposal is voted down, or Congress does not send a balanced budget amendment to the states by the end of the year, automatic spending cuts totaling $1.2 trillion would go into effect, cutting Medicare payments for hospital care by approximately $1.3 billion. Neither option's good for Pennsylvania, for hospitals, and/or patients. Hospitals across the state have already received, or will receive, $9 billion in payment cuts for hospital care as part of the federal health reform package. In addition, the recently passed state budget cut 4% in Medicaid payments for hospital care. Providing the best health care possible in a safe, compassionate environment is a commitment every hospital makes to its community. Hospitals are open 24 hours a day, 7 days a week, and are often the only source of health care for millions of Pennsylvanians. Additional cuts in hospital care could force hospitals to make painful decisions about what services they can continue to provide, which could overload emergency rooms, shut down trauma units, and reduce patient access to the latest treatments. Pennsylvanians depend on the care Medicaid and Medicare provide. Jeopardizing that care with additional cuts is bad medicine, bad politics, and bad for Pennsylvania. We'll continue to keep you up to date on this important issue and let you know when you can help. Thank you for your continued support.